All right, so here we go. So I have with me today Dr. Patti Zub. Patti is a functional medicine doctor, and she has been my functional medicine doctor, and she's a good friend, and she's an energy medicine practitioner. She's really a just all-around cool chick. So I'm super happy that she's here with us today. And we're going to talk about immunity, virus. I don't know. What can you tell us from a doctor's perspective about what we're going through right now?
First of all, thank you for that nice introduction. I appreciate that, and I'm excited to be here. I think there's so much going on in the world right now, so much uncertainty, so much fear, so much information being thrown at us. And the fact of the matter is there's a lot we don't know because this is a novel virus. And
Novel
we're
just means
learning as we
new,
go.
right?
Right,
It
it means new. So
Yeah.
never in human history have we seen this virus before, so our bodies haven't seen it. And we're starting to understand a little bit and figure out how our bodies react and why. And as we learn this, we're getting some theories and trying different things. And, if we had this conversation 2 weeks ago, it'd be different than the conversation we may have today or 2 weeks from now. But there is information coming out. There are other similar viruses in the class of coronavirus. And so we can look at, studies in terms of how to support our immune system, supplementation wise, specifically at viruses that have similar mechanisms of action. And as we unearth more information about what this virus is doing, that may alter our recommendations. So, we can talk more about that as we go on. There is some new information that I'd be happy to share with you that I've just read recently.
Yeah, what is it?
Well, what it is, and this is, a functional medicine colleague who wrote a beautifully written and researched article recently, looking at the coronavirus or the COVID-19, the disease in particular, trying to piece together why it behaves the way that it does. So we know that people get very low oxygen levels, and that their oxygen drops lower than, if you were to look at them, you wouldn't think that their oxygen was as low. So they may not be short of breath, but you put a little monitor on them and their oxygen level is low. And so there's a little discordance between the amount of what we call hypoxemia and the amount of symptoms in some of the milder cases. And this use of ventilators to treat the kind of consequence of what we believe is the body's immune system response being overactive, and making those that lung tissue, the alveoli, are where literally the oxygen comes in, passes through a thin membrane, and then gets delivered to the red blood cells. And that's how oxygen gets into our body. And so the focus has been on improving that oxygenation using a ventilator. And that works for many other disease states, but for some reason that we've had a hard time understanding, it doesn't work as well for this condition. And what may be a piece of that, and again, this is not fact, this is very interesting, kind of based on medical knowledge and things that make sense, but the observation is that perhaps this is not the oxygen getting through the lungs into the red blood cells, but the oxygen getting onto the red blood cells, and that the virus binds the red blood cell and disrupts that process at that level. And that's why putting oxygen in through that ventilator into the lungs isn't working as well as we would expect it to, because that's not the whole issue. And so one of the current possibilities is that this virus binds, or red blood cells are the cells that make hemoglobin, and hemoglobin has some iron, and that's how the oxygen attaches. And so when people have low iron, they get anemic, or if their hemoglobin is low, they're called anemic, and they may look pale, right? And they may get short of breath because they're actually not getting good oxygen delivery. So one of the current thoughts is that that virus is binding and pushing off that iron and that hemoglobin. Wow. And the virus is sitting there. So the virus is floating around in the red blood cells, and it is disrupting that normal process so oxygen can't bind. And it's also throwing off a lot of iron into the blood. And that iron needs to be taken care of. And one important mineral that helps with that is zinc. And so we've heard a lot about zinc, right? You know, people are talking about zinc and how that might be helpful for viruses in general, and maybe for this particular virus in particular. And so one thought is that that excess iron needs to be taken care of by zinc. And one of the symptoms of low zinc is actually a loss of taste and a loss of smell.
Wow.
And if you think about people reporting before they get sick, one of their first symptoms is they lose taste and they lose smell, right?
Right.
And so perhaps part of that is the body is utilizing all its zinc to try to take care of this extra iron load. And iron, when it gets oxidized, it's kind of like rust. You know, that's what happens when things rust.
Yeah.
And so if that is going on and our body can't keep up with it, we have this profound inflammation that affects all organs, not just the lungs.
Right, because it's been going into people's kidneys too. I hear that people have kidney failure and all kinds of other
heart
organs shut down. That's not just part of the cytokine storm that happens, but they're now saying maybe it's due to, you know, or they're wondering, what I'm wondering as you're saying that is the fact that it's hitting some of the other organs maybe due to the iron.
Yeah, I think it's a whole body reaction, really. And I think it overwhelms our system and our ability to take care of it. And we know certainly the heart gets affected. That we've known for a while. And so to me, it was very interesting to me that it makes sense as a kind of the scientific part of me and kind of understanding why we're having such a difficult time and why people, you know, some people get so much sicker than others. And that's kind of a complex issue. But, you know, I think that's very thought-provoking to me, that idea. And the other interesting thing is one of the medications that is being explored, you know, conflicting data as to whether or not it helps people or not, is a malaria drug called Plaquenil. And it, you know, it may be helping some people. And so malaria is a parasite that affects the red blood cells. And so here, this malaria drug is potentially helping people who have COVID-19. And, you know, then there's this theory that maybe it's more happening at the red blood cells, and that's why we're seeing what we're seeing. And one of the things that Plaquenil drug does is it helps to get zinc inside the cells. And so, you know, zinc is a natural antiviral. And so we can get that zinc inside the cells and the body can fight off stop the replication of the virus, and people can do better. And so, you know, that's some of the newer thinking out there. Again, theory, not fact. You know, for me, it's kind of, you know, promising. And, you know, I think there's some empowering things about what are coming out, that, you know, that there are things that we can do. We all know we need to social distance and wash our hands and not touch our face. And, you know, I think everybody's kind of got that message loud and clear. You know, and I think it's a good time for people to look at how they treat their body and their immune system, care for themselves and each other and the planet. And, you know, food is powerful medicine, and lifestyle factors are powerful medicine. So if we want to talk about how can we support ourselves during this, you know, kind of scary time where there's a lot of unknowns, you know, I think those are things totally within our control, and that we can use the gift of this time that we all have at home right now, whether we like it or not, maybe by upping the ante on the self-care.
I know, probably like a lot of people, I spent the first 2 weeks of the lockdown eating my face off. Just like, I'm like, if the world's gonna die, I'm gonna have some cheese and drink some wine and eat a whole entire thing of brownies, you know.
And, well, that sounds reasonable, Lisa.
Right? I know. It was really fun too, Patty. Every single second of it, until I didn't. And then all of a sudden I was like, oh, I don't feel that good. Like, you know, okay, it looks like maybe the world isn't going to end and I need to stop and go back to eating a fairly clean diet, which is sort of my normal thing. And, and what can we do for people that have gone down that? I know I'm not the only one. So how can we kind of get back on track here with our self-care?
Yeah, I mean, that's a stress response, and I think we're allowed to have it, you know, and we all have different stress responses. It was really fun. I'm glad you enjoyed it, you know. You know, but I think, you know, stress is a fact of life. This is a tremendous stress. And so we can work on tools to help our body. We can't make the stress go away, right? but we can respond to it as opposed to react to it. And so there are things that we can do in our choices that will kind of give us that presence that we can say, okay, this is what's going on, but I have the power to choose how I want to respond rather than react in a way that takes it out really on our nervous system and in our immune system, which is the exact opposite thing of what we want. So when we go into that stress response, from the fight or flight, right? So we have this physiology of elevated cortisol and adrenaline. It's very pro-inflammatory, and it suppresses our immune system. So at a time when we want to be nurturing our immune system and building a strong immune system, because this virus isn't going to go away, we are all going to get exposed to it. A vaccine is not going to be the answer. If we can support our own healing through our immune system, that is going to go a very long way for many people.
Do you think it's likely that everyone's just going to get this virus sooner or later?
Yeah, I think so. I don't know if you just saw, I was, scrolling. I really truly don't watch the news, but I was came up on my phone that they tested. There was some COVID-19 at the Pine Street Inn in Boston, and so they tested close to 400 homeless people staying there, and close to 40% of them tested positive, and 0 of them had symptoms.
Right.
So, we're all getting exposures. There are many people that have asymptomatic disease. And so once we get herd immunity, so enough people have been exposed and and people's immune systems are containing it, in all likelihood, we really don't know if having those antibodies is, how long that's protective for, but it probably is.
So an antibody test isn't really a great indicator of whether you're immune to it. What about if you can pass it? Like if we do the serology test and you find antibodies, does that mean, and is it going to be like everyone has a certificate that says they have it and then we can go out and about, or does that really not mean anything?
I don't think that's realistic. There's antibody testing out there, and I think that it'd be good for most of us to get it and know if we've been exposed. And I think we don't have to live in as much fear, number one. And then I think part of managing stress is being of service. And so I don't know about you, but if I knew I already had it and I had probably had some immunity, I'd be more likely to go out there and help other people rather than, sit at home all day, right? And so I think the antibody testing is good. It's important. I think we're all going to be getting it. They measure a couple of different antibodies that can kind of show recent exposure and, exposure that has more past, that we get a different antibody that presumably, we don't know, but probably gives us some form of immunity. So if we're exposed again,
how long, because it's a novel virus,
right? Yeah, we don't. And so that testing is out there. There's some companies that I work with that actually are coming up with one where you can get a kit at home, do a finger stick, mail it into them. So that's probably coming in a couple of weeks. Really looking forward to that. So but in terms of helping ourselves through this crisis and managing the stress that takes its toll on our immune system, getting simple things like sleep. Sleep is hugely important for our immune system, for our detoxification. That's when our body does its cellular cleanup, and that's when we rest and rejuvenate. So, getting a good night's sleep is super important for the immune system. So it's really easy to be off track, being at home, not having a schedule, trying to keep a regular routine. Our bodies thrive on routine. And so try to keep that circadian rhythm, something, what that feels natural to you, but something that's regular. So going to bed at the same time, getting up at the same time. It's very useful to be outside in the morning, first thing in the morning to go outside, get some natural light, put your feet on the ground, on the earth. That really helps to entrain our circadian rhythm. And that will, teach our body, in terms of our cortisol and other hormones that play a role in the sleep-wake cycle, that, it's daytime, we're up. And then in the evening, taking a break from the technology, limiting your blue light exposure, going off the smartphone or the computer and reading a book, like one that's made out of paper. Remember those, right?
Yeah, I do.
And so, you know, and having a routine that tells your body it's time to go to sleep, and avoiding, you know, too much alcohol in the evening will really disrupt the sleep. Hugely important for the immune system to get a good night's sleep, you know.
Right. Yeah, and eating clean, I know is important, like too. That's,
Yeah.
keeping your chemical load down, eating organic if you can, and or just sort of a healthy fruit and veggie, clean meats kind of diet.
Yeah, yeah. So I think that it's a really good time, if people haven't already, like you kind of went through this and you're on the other end, is to kick the sugar.
Mhm.
Sugar is, you know, promotes inflammation, suppresses our immune system, has nothing of value to our body in healing.
Yeah.
And, you know, I think of, you know, try to eat the rainbow every day.
Mhm.
All the nutrients and those different colors in the vegetables do different things to keep us strong and healthy. So, you know, I try to hit the rainbow. Some colors are easier. Greens are pretty easy. You know, those kind of blue purples, those are harder, but, you know, try to get, you know, 8, 10 servings a day of, you know, fresh, mostly, you know, more veggies, less fruit. But, you know, try to eat that rainbow of clean, real food, organic if you can. Getting protein. So, you know, if you eat meat, doing grass-fed meat, or organic chicken. If you don't, like legumes are a good source of protein. So vegetarians and vegans out there need to pay attention to that, because you can't have a healthy immune system if you're not getting enough protein. And so, you know, that in and of itself puts our immune system in a better spot. So when we encounter a virus like this, that we can fight it off without going into overdrive.
What about supplements? So vitamin C, we know. I've heard rumors that there's been intravenous application of high doses of vitamin C that
Mhm.
have been effective. I don't know. What do you think about that?
I think high dose vitamin C is amazing. I think it's great if you're coming down with a cold to go and get some in, you know, any kind of viral infection. And so a lot of functional medicine clinics will offer that. And it's something we were looking into at my practice at For Better Health. But the timing isn't quite right because we don't have the space right now to do that. But in China, they were using high dose intravenous vitamin C. There are hospitals in the United States where they are using it. Vitamin C is not a natural anti-inflammatory. It actually helps support the immune system, and it also reduces the viral growth, the viral replication. And so, you know, it mops up that oxidative stress of the inflammation, those cytokines, and our immune system is working hard to try to clear something. There's like this, you know, inflammatory storm that can happen, and so it kind of helps with that too. So if we don't have access to IV vitamin C, and you know, hopefully we're not in the hospital in need of it, we can take oral vitamin C. And so doses between 1,000 and 3,000 milligrams a day are very appropriate. If you are someone who knows you have a type of kidney stone called an oxalate kidney stone, you don't really want to go above 1,000, because that could, in theory, precipitate a kidney stone. But anybody else, 1,000 to 3,000 milligrams a day is really supportive to the immune system. Vitamin D is extraordinarily important for a healthy immune system. It's actually a hormone. It's not just a vitamin, it's a hormone. We have a receptor for that on every cell in our body. So it does, you know, a myriad of things that we need. And one important thing is the immune system support. So, you know, if you know your vitamin D level, it's a little easier, but I think generally doses of up to 5,000 IUs a day, supportive for the immune system. And vitamin A, which is another one of those fat-soluble vitamins.
Yep.
Extraordinarily important for the immune system to work well. And as a functional medicine practitioner that does nutrient levels, I'm surprised at how many people are out there that are actually low on vitamin A. And so, you know, that's something that's appropriate to take, you know, during this time between 10,000 and 25,000 IUs a day, you know, to support the immune system. So those are definitely good ones, along with zinc too.
Have you heard anything about copper in this virus, colloidal copper, or what copper?
No, you know, I haven't. I will tell you the caveat with zinc is that if you take too much zinc, you'll deplete your copper. So most people don't have an issue with copper overload. If they do, zinc's a good treatment for it. If you're taking long-term or more prolonged zinc, you really need to make sure you're getting some copper in there because it's a balancing act. So too much of one will deplete the other, and low copper is not good for our immune system. You know, our bodies are about balance. Too much of anything is not a good thing.
Right.
And, you know, not enough is not a good thing either. But I haven't heard anything personally about copper in specific reference to COVID-19. But you know, there is concern about depleting yourself of copper if you go on for a long period of time taking zinc without any copper.
Well, Patty, just want to put a plug in here for your business and also for functional medicine in general. Like, can you just describe for people maybe who don't know it what functional medicine is and how it's different from regular Western medicine? And
Sure.
you were a traditional Western medicine doctor for 20 years, or you were in?
Yeah, something like that. I mean, I still am. I still have that knowledge, and I'm very grateful for it. You know, and I don't see it as a one or the other system. Actually, I feel they both bring value,
Yeah.
and I value my knowledge that I obtained and my understanding of disease. And so I think that, you know, the allopathic system is really disease based. It's not really, it does not have a skill set in promoting health or healing. And functional medicine is much more holistic, with the idea that we want to get to the root cause. Why is the body exhibiting these symptoms? And so if I have a headache, it's probably not because I have an ibuprofen deficiency, right? Maybe I'm just a little dehydrated, or maybe I need magnesium, or maybe I have a food sensitivity to eggs and I just ate an omelet, you know? And so when the body exhibits a symptom, functional medicine strives to understand, why is that? Why is this check engine light going off saying, hey, something's out of balance? And we really understand how deeply interconnected all the body systems are. And really in conventional medicine, you get, you know, you have a headache, you see the neurologist. You have a joint ache, you see the rheumatologist. You have an upset stomach, you see the gastroenterologist. And no one's looking at how all those systems interact. And how what they're doing is affecting another part of the body. So functional medicine really strives to bring balance, identify what things may be creating a problem, like toxins, infections that are undiagnosed, and you know, what the body needs to help itself do what it wants to do, which is heal. And so sometimes that's, you know, a little omega-3, or it's a little magnesium, or it's a little more sleep, or a little more connection in your life. And so really that's where functional medicine shines and really helps people come to like a deeper level of healing and vitality and health.
Yeah, I refer quite a lot of people to functional medicine, and off to you actually, because our
Yeah,
office is
thank you. We're so
so
lucky.
you know, I'll refer people to you when they have like a mystery illness that you know that they haven't been able, that you know, allopathic doctor hasn't been able to diagnose, or when I know somebody has a problem in their hormone system, their endocrine system. I suspect a thyroid or an adrenal glands or things, and I don't know if Western medicine is always as good at balancing the adrenal system. They don't have, it's a bit of like a sledgehammer on a walnut kind of thing, and what you're doing is more subtle, you know,
Exactly.
in dealing with the subtle balances and everything. And I know you're still practicing, you're doing telemedicine right now.
Right. Yeah, we are.
Yeah,
We're here for people. Yeah.
Yeah, and I'll just post the link to your business in the to your practice. Do you only work with people in Massachusetts, or do you go across?
You know, I'm an MD, I have a medical license, and in the state of Massachusetts, you know, by licensing, and Lisa, my nurse practitioner, business partner, she and I own the practice together. Our licensing both require that we physically examine a patient. So for the first visit, typically we see someone in the office so we can examine them, and there's value to that. So I don't think that's a bad rule per se. Subsequent to that, we just need to examine someone once a year. So we do have, you know, patients who, you know, travel from all across the United States, and even some people from out of the country that come to see us, and they may fly in or drive in and see us, and then we do telemedicine for our follow-ups, and that seems to work really well. And I really think it's the future of medicine, and I think, you know, as everybody's having to do a telemedicine platform, now we're seeing how nice and convenient that can be, actually.
Absolutely.
But I will tell you, my For Better Health business webpage, so For Better Health, the number 4, betterhealthmedicine.com. We have a handout of the supplements that are shown to have research to support the immune system during viral infections. And it's a nice little handout. It has the doses, so some of the things that you and I already spoke about, and there are a couple of other things on there like curcumin and quercetin and acetylcysteine. So people go to forbetterhealthmedicine.com, they'll be able to, download or print up and get a copy of that handout with all the supplements that are reasonable for people to take to support their immune system during this time.
That's great, Patty. Thank you so much for being with us, all of us here today. It's really enjoyable.
My pleasure.
I so appreciate it. And I think it's important to get real information because there's so much flying around. There's so much, questionable information, misinformation, flat out, crazy conspiracy theory. And I love a good conspiracy theory, so I kind of I sort of dig down into that, and I'm like, I want to ask Dr. Patti what she thinks about it.
I don't know the answers to those, and I don't know, 6 months from now what we will have figured out, but I feel very confident in, certainly the supplements and the lifestyle. Those things are clearly going to be a benefit for us all. And I know I'm doing it myself and my friends and my family. And, I think gives us a power over a situation that can feel powerless at this time. Yeah.
Thank you so much.
All right.
Patty,
My honor and pleasure.
I love the conversation, and lots of love to you, honey.
Same to you. Bye.
Bye.